The neonatal pressure monitoring and blood conservation system from ICU Medical is designed to help you reduce blood waste while minimizing the risk of IV line contamination and the transmission of infectious disease. The following demonstration will walk you through some of the important steps required to set up, prime, and obtain a blood sample using the system. Before you begin setup, ensure that you have an IV fluid source, appropriate infusion device and extension tubing, and a sealed neonatal pressure monitoring and blood conservation kit. To begin setup, first remove the kit from its sterile package and make sure that all connections are secure. Next, attach the sheathed syringe to the female lure at the end of the 6-inch extension tubing connected to the secondary stopcock. Attach the pump set to the female lure above the squeeze flush device and rotate the handle on both the zeroing stopcock and the secondary stopcock off towards the sampling port so the set can be primed. Next, remove the white vented cap from the zeroing stopcock port and begin priming by activating the flow of IV fluid and squeezing the flush device with the transducer in the inverted position. For priming, make sure to use only gravity or pump pressure. If the set includes the blue non-removable zeroing cap, rotate the cap counterclockwise until it is loosened. As you prime, make sure to clear any trapped air from the transducer and zeroing stopcock. Once the zeroing stopcock is fully primed, rotate the zeroing port stopcock handle off to the zeroing port and attach the yellow non-vented cap. If the set includes the blue non-removable zeroing cap, rotate the cap clockwise until tightened. Continue priming until the 10 milliliter sheathed syringe is full. Once the syringe is full, rotate the handle on the secondary stopcock off to the transducer. Next, ensure the handle on the sampling stopcock at the patient end of the kit is pointing opposite the blue sampling valve to allow the line to remain open and be fully primed. Then, invert the sheathed syringe so that the trapped air migrates upward and depress the plunger to 7 milliliters to prime the remaining line. Once more, ensure the trapped air is eliminated from all tubing and stopcocks, and if necessary, continue to prime the set by activating the flow of IV fluid and squeezing the flush device. When the set is completely primed, rotate the handle on the secondary stopcock off to the sheathed syringe. Finally, attach the male lure to the patient's catheter or other vascular access device, and you are ready to begin using the closed blood sampling system. To obtain a blood sample, first ensure the handle on the sampling stopcock is rotated to point opposite to the sampling valve to allow the line to remain open. Next, rotate the handle on the secondary stopcock off to the transducer and slowly pull back on the plunger of the sheathed syringe until the discard or clearing volume of blood reaches the black line on the tubing. Once you have drawn the appropriate volume of blood discard, rotate the handle on the sampling stopcock into the sampling position or off to the transducer. Next, swab the sampling valve per hospital protocol and attach the sampling device to the valve on the sampling stopcock and slowly withdraw a blood sample. Once the blood sample has been drawn, swab the valve per facility protocol and re-infuse the clearing volume by rotating the handle on the sampling stopcock to the open position, opposite the sampling valve, and slowly depress the plunger on the sheathed syringe using a gentle pulsating technique to return discard blood to the patient. For more information about setup and use of the neonatal pressure monitoring and blood conservation system from ICU Medical, please contact us today by visiting our website at www.icumed.com.